Welcome, my name is Hilda Jacobo, and this is my colleague Maya Stansel, and we will be talking to you about the anti-vaccination movement and how advanced practice providers can make a difference. The anti-vaccine sentiment dates back all the way to the 1790s when the first vaccine for smallpox was being developed by Dr. Edward Jenner. At that time, people thought getting the vaccine would give them cow-like features. Myths continue today, mostly surrounding the safety and efficacy of vaccines, and they're linked to autism, which has been disproven, and that study has been retracted. Consequences are not only here in the United States, but also global deaths, and specifically here in the US are due to re-emerging diseases like pertussis, measles, mumps, and these are all vaccine preventable conditions. Most recently, now that we have a vaccine for COVID as well as HPV, these have also become vaccine preventable diseases.
Yes, the role of providers is to provide evidence-based information. And the core of that is that vaccines are the most successful method of preventing disease. So as providers, we want to address myths, we want to give facts, we need to advocate for our patients. Some of that will involve providing education in their primary language, continuing with our cultural competency to understand where patients and families are coming from. We can also do web-based training through the CDC. Their program is called You Call the Shots. We can refer to the Advisory Committee on Immunization Practices, the ACIP, which is updated regularly. We also can assume leadership positions in vaccine programs at the local level and beyond. Now, as far as combating vaccine hesitancy and resistance, we can utilize many methods. This could include social media, this can include news outlets, this can include publishing in journals, but getting the message out there. Now, with individuals and families, it's essential to build rapport and trust over time, to utilize facts and figures, to include the risks of vaccine preventable disease, to also include risks and benefits of vaccinations. This may include pictures of patients with these diseases to provide stories along the way. We can also support legislative mandates. Now, as far as education, we want to do our best to identify the exact fears of our patients. The literature shows that there's just a high need to listen to our patients well. Many people have a general fear of needles. We can also acknowledge the possibilities of conspiracy within the vaccination world. We can also address the high conformist stance that is pretty common within anti-vaccination movements, and address that logically, that the movement is asking everyone to conform. We want to give very clear messages on consequences, and that includes, but is not limited to, the symptoms of disease, the treatment, and the potential for hospitalization and death. We can utilize a lot of resources through the CDC website. There's a fact sheet that is called If You Choose Not to Vaccinate, Understanding Risks and Responsibilities. We can utilize this in our practices. It is shown to be true that the #1 predictor of vaccine compliance is provider recommendation. So our role as providers is to recommend at each encounter to do our best to educate and administer vaccines. We know that a collaborative approach is very helpful. So we want to consider how pharmacists positively impact access, as well as school nurses, health departments, subspecialties, as well as travel clinics. Also, the role of urgent care centers and hospitals in this. We have talked a lot about individual change, But as far as societal level change in regards to this movement, it will need to come from provider leaders who engage the issues. Thank you so much for your kind attention.